We really just want to say thank you to SCORE and our panel of presenters today for providing this very timely and valuable topic and dialogue opportunity for our partners. We are very appreciative.
Very great. So now I'm going to bring our presentation up, hopefully. Kathy, I've lost the, there we go. Kathy, do we have it up?
You have to click share screen at the bottom, and then a box will pop up with, there you go. There you go.
Okay. All right. All right, great. Thanks, Laurie. Good afternoon. My name is Denise Fessler, and I'm a volunteer with SCORE, and we're really excited to be here today to talk about sustaining safe business operations. And see if I can, for some reason I can't advance my slide.
I'll drive it for you.
Thank you. Oh. And we really believe we have you covered today. We have a great panel of experts available. We have first, starting us off will be Robert Teke Drummond, who is the Executive Director of Corporate Partnerships for Penn Medicine and also Executive Director for Penn Medicine HealthWorks. And he'll give us an update today on the status of COVID in our community and also the key measures to follow. Monica Rakoczy is an OSHA specialist, and she has a business under training solutions. She's also a SCORE client. We're excited to have Monica here today to talk about OSHA regulations. She's also a prior SCORE SBL winner, so thank you, Monica, for attending. Carl Shaak, who is an HVAC specialist and also the manager of Berkshire Mechanical at UGI. He's here to talk about ventilation systems, which we know is a very hot topic, so we're happy to have Carl here. And last but not least is Laurie Holmes. She is a health, wellness, and safety specialist with Americhem International. She'll talk about disinfection and cleaning protocols and the latest on that as well. So welcome to all of our expert panelists. Our process, as Kathy stated, we're going to go over a good 45 minutes of information on each of these topics, and then we'll have plenty of time for question and answer. So safety considerations, why are we talking about that in October? Here we are. It's very critical right now to operate safely. We know that. It's critical because your business really depends on it. You have management of competing priorities. We have rapidly changing conditions. And it's really important to really sustain that focus on safety. We found as we've been giving these presentations, and we've done a number of these now, that it's important not only to focus on COVID, but also to just even look at some of the basics and making sure that we can focus on safety in totality. And it's very important that we have now this focus on safety overall. And we believe, again, that we have you covered as far as from a content perspective. Next slide. So our agenda is that we're going to be going over some tips on maintaining safe operations. We'll have the expert panelists present, and then we'll have a substantial section here for asking specific questions as it relates to your business needs. Next slide. A little disclaimer here is that this training presentation is meant for instructive purposes only. It does not constitute legal advice, and it does not provide assurance of compliance with the many facets of applicable law. So what are some tips on managing safe business operations? First and foremost, it's really critical to make sure that you're up to date with the federal, state, and local and industry-specific regulations and guidelines. And that means that you need to make sure that you're tapped into the social media links that give you updates as they occur. And we know that the state of Pennsylvania has recently updated guidelines for events and restaurants and their number of occupancy rates. So we want to make sure you're up to date with that information, make sure you're linked in and can have opportunities to ask questions specifically as it arises. The second tip is really important too, is to make sure you have a plan. You don't want to not have a plan. It is required even to have a plan, but you want to follow and have this preparation so that when things do happen, you have a plan for what to do when it does happen. Every one of us on the panel has been contacted by a business owner or some manager when something has arisen, and it's like critical, mission critical, to make sure that they know what to do. Having that plan, having policies in place, make sure that you have a consistent approach and that you are prepared. The other thing is making sure that you have somebody assigned as responsible for maintaining that plan and changing policies as guidelines change. And that takes leadership. It means that in small businesses, that'll be an owner. In a larger business, it'll be a manager. Bottom line is you have to demonstrate that you can minimize risks to both your employees and your customers. You want to continue to update employees and customers regarding your plan. You don't want to just put your plan together and not address it. And you want to make sure that people are aware of what your plans are, what processes you're taking, that they can see what you're doing. That may mean that you post what your process and policies are. You may want to update them on your Facebook pages, etc. Primarily making sure people are aware of what you're doing. As far as employees, it's using daily checklists, creating reminders, conducting routine audits. Again, making sure it's top of mind and that people are really aware of what needs to be accomplished. Why you want to do that really is because you want to minimize risk, but you also want to demonstrate at this time that you really care. You care about your employees' health, you care about your own health, you care about the health of your customers. And reinforcing that culture of caring really does make a difference. It's the difference between whether somebody wants to be with your business or some other business, if they really believe that you do care and you demonstrate that caring. The last tip that I wanted to make sure we get across is that we are definitely in changing times, and you want to be prepared as a business for an accordion-like process, meaning that there'll be times where the virus will rear its ugly head, so to speak, that it rises. We're much better at understanding where that's occurring. We see that in New York City, for example, where there's certain boroughs where there's a rise in the virus. And rather than having some blanketed approaches from a government perspective, there may be more targeted approaches from a government perspective. But by and large, as a business, you want to continue to be creative. You want to make sure that you maintain your pivot strategies, even though they may not necessarily be as utilized as they may have been in the past. Try to keep them alive in case you have to use them again. Our next panelist is Teke, and he'll talk about the community update as it relates to COVID.
Okay, thanks Denise, and thanks for having me. Yeah, I'm going to try my best to give everyone a broad overview on where we are. There is some specificity in there, but some of this stuff you haven't, it's not new to you, but I'm going to reinforce it, and we continue to learn all the time more and more about the virus, and then I'm going to pass it over to my colleagues to get into a little more specifics about what you can do, in your place of business to kind of keep yourself safe. And I saw the list, and I've met with a lot of you guys individually, so I know that there's a lot of work that's being done, and everyone knows you can always contact me specifically if I can help out in any way. But yeah, let me run through it. So let's go to the next slide. So this first slide is it's intended to be an overview, and it's not much different than what I've been doing since I've been doing these talks since April. So it's now been 6 months, and not a lot has changed here, but it does. The point of this slide is really just that. Not a lot has changed, and if we really do want to control the virus and the spread of the virus, you have to stay committed to a lot of these issues. So it shouldn't be unfamiliar to everybody that it is that it's spread by close contact via respiratory droplets. There was some discussion about it being airborne, and which still might be the case, but even an airborne element of that is the least of which you have to be concerned about. The vast majority of the spread is through the droplets, which is why the 6-foot distance is imperative. So social distancing is crucial. People are also worried about the surface contamination. That also is a bit of red herring. Yes, it can happen, but it's far unlikely than the droplets are. The symptoms there you can see, and this is important because when you go through this list, you can say, well, yeah, a lot of things can affect that. And we're coming into the season when we have the prevalence of a lot of respiratory illnesses. And so you're going to have people start showing up with these symptoms that may or may not have COVID, but you're going to have to investigate. And for those in the group that are employers, you're gonna have a more frequent kind of use of the system to confirm what is their illness, and the consequences of having COVID are a lot more impactful on you as an employer than it would be if it was just a high-end cold or another respiratory illness. The key on this virus, which is why it's so problematic, which everyone should know, is the asymptomatic spread. This is not an Ebola where the minute you get it, you start having these really severe symptoms. This is where you can go no symptoms the entire course of the virus. You can have no symptoms until most of the symptoms don't really emerge until day 4 and last and peak until day 7. So ultimately, you can be spreading this virus for a solid 2, 3, 4 days or longer and not even know whether you have it. So that's why this is so infectious, and why we have to put so many precautions out there versus some other respiratory illnesses that are out there. Let's go to the next slide. So this reiterates what I was mentioning before. With respect to the fact that it is so contagious, masks are what prevents it, and ultimately you're wearing the mask not for you, you're wearing it for everybody else. These are not unique. These are items that particularly us in the health industry do all the time, the hand washing, disinfecting services. That's what we're all about, and that's what it's nothing major. This is pretty simple stuff that we're asking people to comply with, and if we are able to comply with this, the consequences of this, economic and otherwise, are really minimal. Let's go to the next slide. So on this slide, you're looking at where we are today, and all of you have access to this. This has been put out from the governor's office since the disease started. So you can go onto this and identify with it, but I provided it for you for our discussion. And on the left side, you're looking at what's happening in Pennsylvania, and on the right side, and what's happening in the county. And the site allows you to detail within any county and on any given day. You can go into it and look at it. So what you're looking at, cases over deaths, and the thing I want to draw out to you is that in Pennsylvania, we're dealing with a couple of hills and valleys here, and you can see the surge that we went under, which was tremendous in March going into April, which we didn't know where that was going to peak. And for whatever controversy is out there from the governor's office and even locally, what we've done, I assure you that peak was supposed to be 2 to 3 times the size it was in April. So there was an absolute flattening that occurred in Pennsylvania, but you can see that it dropped down in the early parts of the summer, but then rose up as we got to the midpoint of the summer, and then dropped down again. And we are on another rise, and this rise is getting pretty significant in Pennsylvania, and it's reflective all over Pennsylvania. So shifting over on the Lancaster side, you can see that we were pretty much flat. Now we controlled, just like the rest of the state, we controlled the curve because of all the initiatives. We didn't come off of that height. I mean, we basically were flat all through the summer with the incidence of cases that are out there. The deaths came down dramatically because we learned better on how to treat them. Less people on ventilations, therapeutics improved themselves. We did a much better job as providers to figure out how to do it. So ultimately, we did a much better job of curtailing a lot of that, but the cases haven't come down at all. And even today, literally today, I think we have about 22 cases in-house in Lancaster General. But you can see, I showed the arrow just to show that it's basically been flat. But if you were to focus in on just September, we were doing pretty good on coming down in September. And then the midpoint of September to today, it's been a steady rise. So that has everyone concerned. I'm sure you've heard this on local and national news too, that there is this second surge that's definitely coming, and we're in the beginning of it. So these precautions are absolutely necessary. Let's go with the next slide. This is just an understanding. It's a little busy here, but I'll kind of walk you through it. This is the concept of positivity of the testing rates. And so ultimately, what the World Health Organization wants us to target, you can see on the right side, is a 5% or lower. That's what we want to do. If we have more than a 5% rate, that's a problem, right? So ultimately, either we're not testing enough, or it is a flat out outbreak. So as we go above 5%, we want to test more to really understand how bad the outbreak is. And we can see there on that yellow curve there, which is the 7-day moving average, what we've been doing is we maintain ourselves pretty much below that 5 point. You can see an increase that's happened over the last several weeks here in September. That's beginning to rise, which is concerning. So the positivity rate is up. We're holding ourselves at a 3.8 right now, but it is rising, and the 7-day average is a little bit higher. So ultimately, we need to be pretty cautious as to what's going on in our community. And I should share with you, I didn't put it up there on the previous slide, but for those of you that live in York or Chester County, they're up as well. So this isn't just with Lancaster. Our surrounding counties are also on the rise. In fact, York has had a significant increase over these last several weeks. But again, the disease doesn't know boundaries. So ultimately, everybody's moving up at a pretty significant rate. So we've got to be concerned about that. Go to the next slide. So this slide, the purpose I had down here is this is where everybody is kind of wondering, well, is it really bad? And ultimately, the word is, well, it's a problem for the elderly. Yeah, it is. From a mortality or from a death rate, absolutely. You can see there on the right side, this is the actual rate that we have from the governor's office as to what's happening in the state. And you can see that, yes, I mean, compared to those less than 50, there is not a significant mortality rate. But I assure you that of the 21 cases that we have in-house, there are many people that are far below the age of 50. Our average age that we've experienced is not even 50 years old in the hospital. So you can see there, yes, it's a high death rate, but look at the case rate on the left. This isn't an elderly virus. This is caught predominantly by the youth. Most of the people who have the positive cases are those 20 to 29. And then look, even ages 30 through 60 have much more prevalence than those over the age of 60. So yes, it is killing those that are over 60 years old, but it is growing in those that are less than 60 years old. So again, the whole point of the precautions are not to protect the individual, it's to protect the others from the individual. So if you're looking at those that are ages 20 through 60, their job is to control the virus on behalf of those that are 60 and above. And just because it's not killing you doesn't mean this disease is not devastating. I can give you countless people, if you don't know them personally, that have been 20 years old, 30 years old and beyond, that they will tell you this is a horrible, horrible virus that you do not want to get. We've done a fantastic job of preventing the death rate. It doesn't mean that the disease course is not significant. Go to the next slide. And this is just the local. So what I want to share with you is I gave you the statewide. Now this is the local shift, and it's the exact same thing that's going on here. You're looking at the distribution of the age demographics, and it breaks down by 5s and not by 10s. So you get to see a little bit more of it. But But look at that. I mean, you're looking at those that are, again, our average age of those tested in Lancaster General Health, 49 and a half years old. And you look at, so look at the predominantly, those that are greater than 70, it's not as significant. The bulk of the infection is ages 20 through 65. So, so again, if we're going to control this virus, it's not those that are 75 that are spreading it. It's those that are 20 to 70 that are spreading it, and that's where everybody on this call comes in. The last two slides I have is the testing slide. So testing is a key. Prevention is the way we handle it. And again, I mean, I know most of you, everybody on this call knows it, that it's not significant. We're talking about a mask. We're talking about social distancing and washing your hands. This isn't a big ask here. But we're doing everything we can from an LG standpoint. We've established a core incident command group that monitors and works with all the schools in the community through SCORE and others. We've been doing what we can, work with employers, and we'll continue to do that. We also provide for pre-travel and post-travel testing for those that go in and out that need to be monitored. And then we have testing for those that are symptoms, which we want to make sure we get the most expeditious results back. And then we have those for asymptomatics that are doing pre-travel, and then for those for pre-surgery. And we're getting ready to roll out asymptomatic testing for those that have, just for the employers. The issue, though, is that when we do asymptomatic testing, which you may have heard, that if you get asymptomatic testing for a close contact experience, just because that's negative does not spare you of doing a full-blown quarantine. The CDC still recommends a full-blown quarantine. The only time you would do an asymptomatic testing and immediately return to work is just purely precautionary, which we don't currently do, but are going to start to do for select employers. What we were trying to do is make sure we have two separate pathways. One pathway purely for symptomatics, other one for asymptomatics, and we're at a point now we can offer that service. What we don't want to do is want to delay any of the symptomatic testing. And lastly, the last slide, go ahead and advance it, this is a program that we've developed and some of you have used, where Lancaster General comes on site to an employer's facility and helps them manage this. We go through and we identify where you're susceptible as an employer. We look at your policies. We bring on our occupational medicine team to assess that. They're then available to provide recommendations thereafter. They do a full-blown report to the executive team. And then we also bring in our comprehensive wellness group that does a full-blown orientation education series for the staff that are there to make sure that they're well-versed. Because like you heard from Denise, the first thing you got to focus on is your staff. Once your staff are well-informed and taking the necessary precautions, then you can open up the doors for visitors, and you can be assured, and the visitors can be assured, that you're a workplace that respects the virus and complies with all the precautions that are being recommended by the Department of Health and the CDC. So it was kind of quick because I'm eager to kind of get to questions after my colleagues go through it. So I'll step aside and let my colleagues jump in. Go, Monica.
Okay. Hi, everybody. I'm Monica Rakoczy. I'm going to be talking to you guys about COVID from an OSHA standpoint. And kind of just tying that in a little bit as to how it is not just public and CDC recommendations, but it's actually legal obligations that you have to be compliant with OSHA regulations. If you could flip to my next slide, please. So a lot of people kind of forget about OSHA during COVID, and I wanted to bring them back into play and show you how they've actually been enforcing their regulations. If you give me my next talking point here, if you go onto OSHA's website and you look at their enforcement of COVID-19, they actually have a running list of all the citations they've already written, and it's being updated weekly. This just happens to be one. It's JBS Foods out of Colorado. When OSHA went in, what they found was the quote is, the employer did not furnish employment and a place of employment which were free from recognized hazards that were causing or likely to cause death or serious physical harm to employees, in that employees were working in close proximity to each other and were exposed to SARS-CoV-2, this virus that causes coronavirus in 2019. Now, what that actually came into doing is the next 2 points is, because they did not put any protocols in to protect their employees, what they wound up with in that facility was 51 hospitalizations and 6 fatalities because of COVID-19. This is when OSHA starts to get into play. If you're not protecting your employees, not only are you going to be down workforce, but OSHA becomes a lot more interested in what's going on in your facility. You open yourself up to fines. Not only that, but the next point is when you deal with something like this, and the next one, you are not only going to have fines from OSHA, you're also going to be dealing with workman's comp payouts for anybody that's out in hospitalizations. You're going to be dealing with insurance increases. You're going to be dealing with staff shortages, which are going to cause an increase in stress on your staff. And if you think about this, if this article were to hit locally and we were to hear about an employer that had 51 hospitalizations and 6 fatalities locally because they just didn't care, it's bad publicity. And let's be honest, we are a retirement community, and we have a lot of older folks in our area. And if they find out that our facilities are just not taking the basic measures to help their employees, it's going to end up impacting our bottom line. So if we could go to my next slide for me. There are, all of you should be, unless you are a municipal worker or a state worker, you're all under OSHA requirement and regulation. So if you haven't ever been through any training or knowledge of what that means, there's a few basic points for you. Number one, OSHA requires you to provide a workplace that's free from serious recognized hazards and comply with the standards, rules, and regulations. Now, as far as standards, rules, and regulations, obviously there's nothing for COVID, but that falls under the General Duty Act that says it's a recognized hazard because we know it's out there and we know how to protect our employees. The next one it says is you're required to examine your workplace conditions to make sure they conform to those applicable OSHA standards. And this is an important one coming into play with everything. Employers with hazardous chemicals in the workplace must develop and implement a written hazard communication program and train your employees on the hazards they're exposed to and proper precautions. I know a lot of you are like, well, I'm not a chemical factory, I'm not, a construction company, but you all have hazardous chemicals. You have cleaning chemicals out there. You have giant jugs of hand sanitizer that's 70% alcohol that's sitting around these days. All of that now adds in a different funk to us that we need to start paying attention to. The next one is, if you don't already have this poster posted up at your facility, you are required to place the OSHA poster up that informs your employees of their rights under the OSHA Act. This is a free poster that you can get on OSHA.gov, OSHA.gov. They'll send you one for free. You just need to make sure it's in a break room or somewhere where they can see it. The next is you're required to provide most PPE at no cost to your employees. In 2008, there was a law that was passed that if you're going to require employees to wear some sort of PPE that you wouldn't normally wear at home, you have to give it to them at no cost. The next one that we have over here is you also have reporting and record keeping requirements. That would be if somebody is injured or ill, COVID-19, at work, you do need to make sure that gets reported if you have 10 or more employees. If that person actually gets hospitalized or ends up dying, you must actually report it to your local OSHA office within 48 hours. If it's an injury or an illness with hospitalization, 24 hours if it's a fatality. All right, next slide for me. So what's that mean with COVID-19 and how can we work with this? Like Teke said, we need to start having a plan. And here's the big thing, guys. With anything safety related, you have to stick to it. You can't just write it down, say this is what we say we're going to do, and then allow certain people to get away with not doing it and other people are doing it. If you're going to allow your management to walk through a restaurant without a mask, but have all of your employees or servers required to wear that mask, it's not going to work because it's not going to be enforceable. Now, with that being said, you have to be flexible. We have seen things change with the CDC, and we need to understand that this plan may need to be tweaked depending on what new information comes out and how it's going to impact our business. Next thing I'm going to tell you is follow OSHA guidance. If you go onto OSHA's website, osha.gov, you will find an assessment sheet for almost every industry out there. There's one for retail, there's one for restaurant industry, there's one for dental offices and doctor's offices. Whatever you are, they have guidance for you to help you implement the strategies out there. And it's going to include evaluating the hazards that you have, how much exposure that your employees have to those hazards, and then what type of mitigation or techniques that we can use. We're going to work through what we call the hierarchy of controls. Avoidance is number one. We can't always do that anymore if we're going to stay in business. So then we move to our engineering controls. This is going to be things like air cleaning. It's going to be things like physical barriers. And then we go into, at the end, we've got things like PPE. Next point that I have for you now is when I say PPE, I want you guys to be super careful with this. I know that N95 has been a term that has been tossed out a ton since COVID-19 hit. N95 masks are becoming more and more available, but be very careful. If you are going to require your workers to wear an N95 mask while they were working, OSHA requires you to put them through fit testings, medical evaluations, and training. And you need to make sure that that is all documented and done, and those fit testings need to be done yearly. The medical evals need to be reviewed by a doctor. It gets very intensive. So please understand that there are tweaks to that. The next one is not only do you have to worry about masks, but even things like gloves. If you're going to require your workers to be wearing gloves, donning and doffing techniques, that's the safety nerd term for how to put it on and how to take it off. There are protocols on how to do that without coming into exposure with the outside of those gloves. If you have not learned that, hop onto CDC's website, hop onto OSHA's website. There is plenty of demonstrations. You can call your local safety or insurance person. We'll be happy to come out and demonstrate that for you, but you need to make sure your employees know that, because just wearing it is only half the battle. Next one that I have for you is please make sure that any of these new cleaning supplies that you guys are bringing in, please, please, please get proper training on how to use it and proper training on how to store it. Restaurant industry, I know that you guys, way before COVID-19, last November, I don't know how many of you watched the news, but up in the Northeast, there was a Buffalo Wild Wings restaurant where a worker had mixed 2 chemicals into a bucket while he was mopping the floor. It caused an evacuation of the restaurant. The manager, who was in his 30s, was the one who stayed in the building the longest to clear out all of his patrons and his employees. When he came out of the restaurant, he was having difficulty breathing. He did end up passing away in his 30s in a restaurant from hazardous chemicals. Please don't think that just because we're not in an industrial setting that we don't need this training and these safety data sheets out there. These are legal requirements, but more so you owe it to your employees to make sure that we're up to date on all of this. Okay. All right, I think that pretty much covers my part, and I'm going to kick it over to Carl to talk about engineering controls and indoor air quality.
Hi. Air quality has definitely come to the forefront of what we're doing today, and we're getting a lot more requests. First slide, please. This here would be like a picture of a normal restaurant, and probably one of the biggest complaints you always get is, you know, when the door opens, you feel that cool draft come in, and you get your patrons are upset and they don't like to sit there. So the major reason for that is a lot of times, like, your building's not balanced properly. So you might have your AC system in the front, but when you have restaurants and so forth with exhaust fans, even the restrooms, they're always pulling air out. So it can put your building under a negative pressure. It can cause a lot of different issues in your building with moisture building up. I've been in restaurants already where the ductwork was dripping wet. You'd be sitting somewhere. And this is just, I thought, a real good picture to show how that negative pressure affects your building. Even in a home, you'll have the same thing. You don't think about it, but I have 3 kids. When they go to take a shower, they're girls. So it's, you know, the 14-year-old's in the shower for an hour. That means the exhaust fan ran for an hour, 20 minutes, and it puts my house under a negative, and it always makes me chuckle. I open the door, I get the same effect as this picture with all the air rushing in. Next slide, please. This one here kind of shows that picture, but just in a layman's terms, you're pulling out, you know, 7,000 CFMs or 8,000 CFMs, but you're only bringing 7 back in the building. So the building's always in a negative. The major thing that we're getting requests on now with the COVID and everything is just getting those air exchanges. So like the rooftop unit that's bringing the air in and cooling the space, we want to make sure that the fresh air is open to that as far as we possibly can without causing humidity issues. The more that's open, it's going to bring in that fresh air to the building and theoretically keep cleansing the air through your filtering system and your coils and any other instruments that you'd have on the system. Next slide, please. This here's a picture of some of the stuff, and I probably look at this more when I go to places, to restaurants or wherever I'm at. It seems like I'm tending to look around, but this here would be a sign like you'd have an issue with like the attic area. It could be in a negative pressure. It could be pulling air back up through the supply vents. This could be uninsulated supply vents, and it causes a little bit of moisture. We're not allowed to say what it is around those supply vents because we're not certified. Like I'm not certified for that, but it's kind of almost obvious what you have building up there. And all this has to go back to like that first slide with just an unbalanced building. Next slide, please. This here would be like the inside of your air conditioning system, and having a yearly maintenance and making sure that your HVAC contractor is cleaning everything is extremely important. Like on the left, you'd have a coil that's just been unmaintained. Like the problem with that, it starts to cut the air to the building. So you're not getting that circulation that you need to cleanse the air and to maintain the proper balance. So it's pretty amazing in 1 year's time how bad a coil will get without the proper maintenance, the proper filtering. And then on the right is just an example of what it looks like, you know, as you're washing it. And the foam is the chemical that we use. There's 2 kinds. We can use like a lesser foam, a lesser chemical for the indoor coil, and a more aggressive. So when you see like the foaming like that, it's actually cooking the dirt out of the coil. Next slide, please. This here's another thing that I go into places and I look up and it's like, you just think, wow, what's the inside of their HVAC system look like? And like, if you're seeing this or any signs of this, you know, you definitely need to have a maintenance done because it's affecting the air quality. You know, you're breathing in what's not sticking to the tile, everything that's blowing in the building, you know, it's filtering through you theoretically. Next slide. Filter changes and upgrading your filters. And this is another, you know, this and fresh air are the top 2 things right now people are asking us for with the COVID. There's different gradings on your air filters. You can go from a MERV 4, which is almost filtering nothing, to a MERV 13. The big thing when you switch over, the higher the MERV rating, the more you're cutting back your airflow. You are filtering out more, but you're also eliminating, you know, some of the proper airflow you might have to your office rooms. So you definitely want to make sure that you're having your contractor take a look and make sure that you can upgrade that MERV rating. Next slide, please. This is a pretty neat chart. It talks about the MERV ratings on your filters and how high you can go and what it's actually catching out of the air. And it's pretty amazing to think, like, even though you're filtering the system, you know, you're only really pulling out like 75 to 80% of anything that goes through your HVAC system.
Oh, bro.
Next slide, please. Things you want to check if, is making sure there's nothing blocking vents. Office buildings, make sure, the vents are blowing. And we're getting to the time of the year where people love to cover up their vents because they feel a cool draft. The problem is when you cover up your vent, that means the air is just sitting in your room stagnant. So if someone would come in with cold or anything, it's going to linger in that office a lot longer than it would if you're moving the air. Changing your air filters regularly, depending on the space, if it gets a lot of heavy traffic, you might need to change that air filter every 2 months. The condition of your air ducts is very important. Like the picture that we had earlier with the tile, like those air ducts were probably nasty. Perform the regular maintenance, making sure you're washing the coils. And then the big thing is always, if you can leave your fan run all the time, especially in the office building, the restaurants, you want to circulate that air 24/7. We get to the in-between seasons now where the air conditioning is not needed, the heat's not needed. So if you're not running the fan, you're really not moving any kind of air. You're not introducing fresh air. So the air is just going to stay stagnant. So you definitely want to run the fan all the time. And that's like a switch on your thermostat. It's auto and on. The big complaint you can get from that is, like in the office, depending where the grills are, people can feel a cool draft blowing on them, even though it's room temperature. Next slide, please. This here's just a picture where it shows, like if you have a rooftop situation at your building, it shows where the outside air would be introduced, and it is through dampering. A lot of systems, it's automatic. You can do that off of CO2. So if it's a restaurant and you want to save and be more efficient, you can do it off the CO2. So if there's only 10 people in the restaurant, you might not need as much fresh air. If there's 40 people, the CO2 level goes up, and you can tweak that, and it would actually open up where it says outside air on that picture and introduce more fresh air. So it's almost as a supply and demand situation. Next slide, please. There's a lot of different numerous air cleaning situations that you can do. At the current moment, it's geared a lot more towards like residential systems. Your office building might have a residential system. You can do, air scrubbers, general air 500, like you can get a HEPA filter, which is hospital grade filtering. The commercial end is a little more limited with rooftop units. You're locked in a little bit to filtering with 2-inch filters and the higher MERV rating. But for homes and like smaller offices, there are definitely a lot of different situations you can use. Next slide, please. Reducing the pollutants in your business. It's fresh air. UV lights are becoming a popular thing. I've not found one, they do a lot of good, but there's nothing claiming that they will remove the COVID completely from your system. I'm a big believer in the UV lights. I have one in my home. I have the 3 kids who, knock on wood, rarely get sick. And I do attribute a lot of that to the UV light. We have that installed in our own office. It does a lot more than, it kills molds, bacterias, anything in the system. So next slide, please. Just a summary, constantly circulate the fan. Big downfall this time of the year is people don't like feeling 70-degree air blowing on them. Filter changes, upgrade your filters. You can go up to the MERV 13. You're going to reduce some airflow. That's why if you're going to go that heavy with a filter, just make sure you check in with your contractor. Even in your home, like I know Home Depot sells like the 3M filters. I think they're like $24. They're a really restrictive filter. You can actually do a lot more damage to your system if you put too much of a restriction in. So I definitely make sure that you're having someone look at it to make sure that it's the right filter for you, as funny as that seems. The ultraviolet lights, there's a lot on the market. I'm kind of prone to the Honeywell ones. They offer ultraviolet lights with peroxide too. You have to be kind of careful with that depending on the situation and any kind of breathing issues that you'd have with people. Usually the ones we're putting in are just straight UV. They don't produce anything. You have the air scrubbers, or a General Air 500 filter. That helps a lot. If you really are in like a dust controlled area, and then humidity control, you can do like a whole house or a dehumidifier for your whole house, or a humidifier, whichever way you need to go. And you got the Berkshire pumpkin always being safe with his mask on. So with that, I'd like to turn it over to Laurie.
Great, thank you, Carl. It's hard to top the pumpkin with the mask, though. I don't know if I can do that. Welcome, everybody, and thank you for joining us today. You can go ahead to the next slide. As Denise stated, I am the Health, Wellness, and Safety Specialist at Americhem. One of the hats that I wear is in the training sector. So to touch to Monica's point earlier, or actually I echo everybody's common theme here is, create a plan and then stick to it. But I'll get into that in just a minute. This is the same poster that I believe Teke had up earlier. Nothing has really changed. If I'd got in front of you even last year, 2 years, 5 years ago, the same steps apply. The only thing that's really going to change as far as cleaning and disinfection is obviously the heightened awareness with COVID, but the high touch frequency of cleaning of the high touch areas. So as you see to the right, we have what's called the chain of infection. And for any infection to take place, there is a chain reaction. In order to break that chain, that's actually where we come in on the cleaning and disinfection part. You start off with the pathogen at the top. You have your reservoir, for example, your hands. That's why we need to wash them so often. Portal of exit, in this case, is the airway, sneezing, coughing, etc. Next is the means of transmission, which Teke has touched on. It's droplet, contact droplet. It's out for debate as to whether it will officially be turned over to airborne. Next, we have the portal of entry. The way it comes out is also the way it comes in. This is why we're wearing a mask, to protect each other. And then last, we have the susceptible or the new host. As Teke had mentioned, it primarily is more sentinel event with older folks. They're the ones primarily passing from the COVID. However, it is affecting a large range of ages, as he spoke to earlier. Okay, go ahead to the next one. So you can put the next one up too. So this is called an ATP meter, and this is basically a fantastic way to measure clean. I can look at a surface and it can physically look clean to the naked eye, but the question remains, is it truly clean? And so what we do is we take a swab, 4x4 swab, we place it into the luminometer. I'm not going to get too deep into ATP testing, but in essence, it creates a reaction where it measures light, and then it will give us a numerical count. So as you can see, the reading to the left was 6,713. By all means, the surface that I cleaned, that's pretty disgusting. And I jokingly say it should have walked on its own. The one that you see to the right was taken after I properly cleaned it. I sanitized it actually because it was something that could be introduced into an orally. So you want to sanitize in that particular case rather than disinfect. I allowed the proper dwell time and then the physical cleaning. I took that read, so I was able to take it from 6,713 to 0. Next slide, or next picture I should say. Yep, there it is. Good old dog bowl, right? Anybody here on the call that has an animal can relate to this. You've gone to grab your dog bowl and it's a little slimy. Well, that's a biofilm. So again, before COVID, there were plenty of things for us to worry about in regards to cleaning. Go ahead. Next slide, thank you. So let's talk, how do we sustain and continually break the chain of infection? It does take a mindset shift. Imagine you're the customer, perception is reality. Create a cleaning, sanitizing, and disinfection program. Adhere to the manufacturer's instructions and focus on high touch areas. Physical cleaning still needs to occur. So if somebody sells you a magic apparatus to spray disinfectant, don't let that, you still need to physically clean. Use EPA path list and approved disinfectants. You can refer to the EPA's list on that. arm yourself with the right tools and product. And then the key is to follow up. Apply universal precaution theory, avoid cross-contamination. And my question to everybody is, how long can MRSA live on a surface? Startlingly, it can live anywhere from 3 to 5 months, the same strain. Teke can speak to that, right? Proper mask wearing. Okay, so let's talk about that real quick. As he had mentioned, not under the nose, not under the chin. Do not remove it to sneeze or cough. And I witnessed 2 different occasions people doing that inside a store. So please, please don't do that. Consider placement of the items relating to best practices. So if you have a bathroom with a pull handle, make sure you put a trash can near the door so that when they open the door, they're using a hand towel. They've just washed their hands. The last thing they want to do is cross-contaminate grabbing the handle. And lastly, be flexible in the state of MacGyverism that we're in. Adapt to using non-traditional methods such as charging bucket systems. Go ahead. So there he is, MacGyver. I jokingly say we've had to kind of switch gears and be very adaptable during this time. Go ahead, next picture. So there we have it. We have the chemical wipe. It's a charging bucket. You put a dry wipe in there. Next one. And then you add, oops, I went a little too soon there, but you add an actual chemical to that. We highly suggest a ready-to-use product versus using a diluted product because Pennsylvania has such hard water that sometimes can mess with the efficacy inside the bucket. All right, next one, go ahead. Thank you guys for your time today. If you have any further questions, please feel free to reach out to me. Thank you for your time. Oh, last but least, the certificate to the left is what Teke has and his partners have done. It's called Kicking COVID Together. They will come to your establishment and do an on-site survey. I partner with that in the fact that I will come and help do training with your chemistry, talk about proper storage, proper use. Please do not mix chemicals. Please label your chemicals. I was just at a hotel and heard a story of a little girl. There was a sales rep, much like myself. He had stuff stored in his garage. It wasn't properly labeled. His 4-year-old ingested it and sadly passed away. So, you know, these things are avoidable, but myself, Monica, Teke, Carl, Denise, we're all here to support you guys. So feel free to reach out anytime. Thank you.
Thanks, Laurie.
Yep.
At this time, I'd like to open up questions to the panel for you to ask specific questions if you have about any of the topics that we covered, anything related to your business. We'll unmute you so that you can do that. Let's see. I can unmute all. There we go. I think I did. I'm not sure.
The only one that's not muted is Kathy. So I think we're good.
Good.
Unless Kathy wants to say something.
Are there any questions?
I had a quick question for Monica. Can you just relate to voluntary wearing of an N95? Can you talk about that a little bit in case somebody
absolutely
would
so
want to wear that? But yeah.
When you talk about wearing, what I think a lot of people don't understand is the term respirator in OSHA's world. If you buy something, and they sell them at Home Depot or Lowe's, if you buy something that has an N95 stamp on it, that's considered a respirator in OSHA's world. Now, if you're going to require your employees to wear that, then you have to go through all that fit testing, you have to go through the medical evals, everything like that. If you are going to offer it as a voluntary usage, there's paperwork that you need to have your employees sign off on saying that they understand it is voluntary usage. You have to provide them with training and you still have to provide them with information. It does exempt you from having to go through the fit testing and the medical evals, but you do still have to have signed paperwork on file for OSHA. I will say that respiratory protection is always in the top 10 most cited standards for OSHA. So this was well before COVID came into play. So be very, very careful with what type of PPE you're bringing in and make sure that you're compliant. If you have any questions on what you have, like even if you have those respirators that have like that you can buy with those little cartridges that guys will wear for painting and stuff like that, same concept. You're going to give it to them for voluntary usage. If you want to wear this while you're painting or sanding, you still have to have those sign-off sheets because those are a respirator for OSHA. Thank you, Laurie.
Yep. Thank you for answering that. I appreciate that.
Other questions?
I was wondering if you guys would be able to share a little bit more about what the OSHA, or not the OSHA, the COVID certification entails, like what that process would be like if you guys came out on site.
Sure. So it's so essentially what it is, we take our occupational medicine team, they come on site, they review your policies, they look at your environment, they do a full walkthrough, and then they debrief with your leadership team, however extensive they are, and offer recommendations. And then thereafter, they're available for consultation if you need anything. And then when we talked about earlier, we were mentioning about the importance of engaging your employees, staff, visitors, that our corporate wellness team comes on and makes sure they get a thorough understanding of what the actual, I'll say, the rational and irrational kind of anxieties of COVID are, and help them work through all that. And then they do two series. One is for the staff, and the other one is for the leadership of the staff. And then at that point, then they're good to go. And then Laurie would give a more detailed kind of review of your your chemicals and whatnot you have available to you. But our focus is primarily to make sure that you're prepared, you have policies set up, and that your staff are well familiarized with what's going on. The biggest issue that we dealt with as a health system and as an employer, knowing that we're the largest employer of the community, is dealing with the anxiety and the stressors that go on with this. And I think we're all kind of normalizing ourselves to a lot of that, with kids getting back to school and just learning how to adapt. But early on, it was huge. I mean, the lack of socialization, all the fears of the unknown, people just blew that way out of proportion. And our job was to control it and educate them on what you need to do to stay safe. And then the other extraneous stuff, we were able to kind of say, that's a fallacy. That's not an issue. This is real. And that's exactly what this team kind of shared with you, is that here are the real concerns and how you mitigate those concerns. So that's what we offer. And then ultimately, what we want to provide is that we give a certificate that shows you completed it. Now, it's not going to say that you're free of infection. None of us will be. I mean, even the most, we get it at the hospital, obviously. So, but what it does say is as an employer, you've taken the time to have an expert come through there and take a look at it. There's a fee for the service, but we give a discounted rate for those that are members of school or others. So we'll take care of that for you. And if you have questions, my contact information is on there. You guys have my email. Just give me a call privately and I'll take care of it.
I appreciate that. Thank you so much.
Sure.
Other questions? You couldn't have done that great of a job. Going through all this information, certainly. I'm only teasing, but
so I'll just jump in unsolicited. The one thing I did not talk about, we were making sure of time, is I hinted a little bit about the respiratory illness season coming up. I don't. You guys need to understand how big that is. So just think back to every time this time of year when, like Carl just talked about, you're closing your vents and otherwise, the air's not circulating the right way, you're moving, people are coming back indoors, the kids are back to school, they're bringing all kinds of stuff home. It's inevitable, right? The colds are going to start to happen, the flu is going to start to have some more prevalence, you're just normal respiratory illness can happen. And there's fear with that, right? Because those symptoms come up, people are going to think it's COVID. Probably isn't, right? There's a lot of other things that could be going on, but you want to know. And so people are going to want to get checked, and they should get checked as soon as possible. And we have tests that they're specific to COVID, and there's other ones that are just deal with all kinds of respiratory illnesses, because the coronavirus has always been here. There is a number of coronaviruses that are out there, this is the one, the COVID-19 is the one that is really impactful right now. So I just want everybody to understand that we're ready. I mean, we have the testing that's available. We can address that at any of the primary care offices, any of the urgent care. The symptom stuff is all covered by the insurance policy. So all of that is free. And so, and the last thing I'll say, and I know that this team here has heard me say this countless times, and some of you have heard it, there is nothing more important right now when we're going through a pandemic than to everybody on this call to have a medical home, to have a family doctor that you can go to. And I know there's a lot of people that want to rely on the urgent care, and we're happy to entertain that. And there's many urgent cares that are out there. It's an unnecessary cost. You don't have to have. We have symptoms. If you have a family doctor, for the most part, those you have it, I can email, text my family doctor right now at no fee, get some guidance. And when you're going into a global pandemic, you would think people would want to have a relationship with their family doctor. So that's my big plug. And I honestly don't care if it's Lancaster General. I just hope that everybody re-embraces the concept of having a family doctor as a medical home. It is invaluable for you because when you need it, they're there for you.
Great. We do have, if there aren't any other questions, we do have a poll at the end of this, for this presentation. If you could, please, it's just 2 questions. If you would just give us a rating here on whether or not you felt that this was a helpful webinar for your business. And this presentation will be available. We'll have a video recording available on them so that your membership will be able to have access to this after the presentation.
We really appreciate that. Thank you. We got a lot of feedback that people were sad to have missed this. So we hope they'll take the opportunity to view it afterwards.
Sure. Last but not least, then also wanted to just put a plug out there that for businesses, particularly those that are, needing some support, we do have available to our community SCORE mentors that are available to help with your business needs. And we're certainly ready and willing to work with businesses to help to support them as they look to pivot, change business practices, start new businesses, etc. So I know Monica has been a client and is still a client, but I wanted to make sure that you knew that we're still there and available, and you can contact us. There's going to be contact information for contacting SCORE. And then also there is a series of references, particularly websites that you'll have available to you on this presentation as well, that for additional information. And all the contact information for each of our panelists, which I'd like to say thank you to. Thank you very much for your time and sharing with the community your knowledge and expertise, as always.